Mr. Speaker, with the recent announcement of new funding to the HS ambulance system, no details regarding the key changes specific to rural operations have yet to be disclosed. Several key obvious problems must be addressed. Enormous delays for paramedics in emergency departments is number one, plus non-emergency transfers, flexing of units into large cities, and faulty centralized dispatch all must be remedied immediately. To the Health Minister, what changes, if any, to these problematic rural ambulance operations will be made with this new funding?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the question. It is certainly our priority to make sure that no matter where you are in this province, that you have quality, timely access to emergency first responders, Mr. Speaker. And we are very proud of the fact that we're increasing EMS funding in this budget by $23 million, Mr. Speaker. I hope that the members opposite will support us in that, in the budget that is going directly to frontlines. AHS is developing their plan should our budget be approved, and then we'll be able to share that publicly with all Albertans and members of this House.
Medal.
Thank you, Mr. Speaker. Given that the Rural Health Services Review final report clearly indicated that the rural EMS units must be treated differently in terms of hospital wait times and mandatorily released no later than 1 hour after arrival, and given that the same report clearly indicated that these rural units should be returned to their home community directly, rather than being flexed and diverted elsewhere to prevent coverage gaps in the local communities, to the Minister, with the new funding, why can't these crucial rural operational problems be addressed now?
The Honourable Minister.
Thank you, Mr. Speaker. And I know that those were some of the recommendations that were heard from folks in the community, and I certainly heard the member's statement yesterday in this House. I have to say that having hard and fast rules about being returned to community, I know no first responder who, when they got called to go to the terrible accident that was happening in Saskatchewan, would want to go back to their community instead of going and running to the call to help those young men who were dying on the side of the road. Mr. Speaker, it's important that we increase funding, that we increase services, that we increase opportunities throughout this province, and that's why we're bringing forward a budget that does just that.
Supplemental.
Mr. Speaker, given that same rural health report clearly identified that rural EMS units and their highly trained paramedics' valuable time was being wasted when taxi-style non-emergency transfers, doctor's appointments and transport duties were assigned to them, and given that instead the obvious solution to that problem is to return to an auxiliary transport system for that need. Right. Minister, with the new funding, why can't that crucial rural operational problem be addressed now?
The Honourable Minister.
Thank you very much, Mr. Speaker. And every year when we've been in government, we've increased the number of non-emergency transfer vehicles because that's the right thing to do, Mr. Speaker. But it's also the right thing to do to make sure that we are increasing the opportunities for frontline paramedics as well through having more first responders available throughout this province. That's why we're bringing forward a budget that has a $23 million increase. That's why we're expanding the community paramedicine program so that transfers don't need to happen unless they're actually required. That's why we're increasing the number of long-term care and acute care spaces in this province, so those patients have somewhere to be, Mr. Speaker, instead of moving for deep ideological cuts like the members of the opposition call on us to do every day.